How important is it to do MDMA the day prior to psilocybin? It's a little bit of a loaded question. We first have to back up and talk about when and why people are interested in using MDMA prior to psilocybin, or also using MDMA and psilocybin as an adjunct, let's say in a polysubstance situation. There is a history of psychedelic therapy involving a stacking of both MDMA and psilocybin. And so people who are not used to the psychedelic state or altered states of consciousness in general, I think a facilitator, it might make some sense to like gear that person towards MDMA. It's slightly less psychedelic. It has a fairly predictable onset and like expected experience. I think that many facilitators think that MDMA can kind of like warm somebody up to a psilocybin experience, especially with its like entheogenic properties or empathogenic properties, meaning like the heart opening experience, the connecting to themselves or loved ones, and even the facilitator, right? So there can be a great foundation of trust that can be built. I see people stacking MDMA and psilocybin. I've certainly worked with clients like that in the past, but I don't know if it's as rigid as saying that you have to do MDMA the day prior to psilocybin. I actually would caution against this because both are serotonergic, and I think MDMA particularly takes a heavier bioload on both your serotonin levels and just like physiologically on you, which leads to more recovery time. Folks report more fatigue, hangover type symptoms because MDMA can really use your serotonin levels. So if you moved into a psilocybin experience the next day, then you're working with less serotonin in your system, which actually might impact your psilocybin experience. My best advice for folks is start with one substance. The rule of thumb with MDMA, you want to give it about 30 days in between other serotonergic psychedelic experiences. So I would maybe consider MDMA and psilocybin only after I've had adequate solo substance experiences. And then that way you can have a better sense on, okay, what is it about MDMA that's working versus psilocybin? But I think it's just important to ask the practitioner why they do it, where their philosophy is around it. Anyone who has a fairly good approach to this should be able to answer that.